So how do you know if you have a tight pelvic floor or not? Hi, it's Kirsten, and we're going to talk about some of the things that you might have that will indicate whether you have a tight pelvic floor, and then go towards those maintenance strategies or treatment strategies. So first off, you might have, and the most common one is pain with intercourse. And there are other reasons why you might have pain with intercourse, such as you're losing some estrogen and your tissues are thinning. But if you have that sensation where things feel too tight, where with penetration you have a sensation of tearing or that the muscles aren't accommodating the size of the dilator, dildo, the penis, what have you, then it might be that your muscles are too tight. Also, if you feel pain deep inside where it feels like something's getting bumped, it could be that you have a tight pelvic floor. So like I said, the most common one is pain with intercourse, and many women have that. In fact, it's one of the things that we don't talk a lot about because we might feel uncomfortable sharing that information. There's some taboos around it. But it's very common. About, well, depending on which study you look at, 1 in 5, 1 in 4 women will have pain with intercourse. The other one is constipation. Again, very common constipation. So is everyone who's constipated actually have a tight pelvic floor? No, it's the whole package, right? We're looking at, oh, they have that symptom and that symptom and that one and that one. Most likely we're going to have to go in there and do some releases because they have a tight pelvic floor. So if you have that sensation where as you're trying to have a poop, you can't quite get it out, like it feels like there's retained feces or retained poop in the chute and you can't get it out, that might be because your pelvic floor is tight, especially a muscle called puborectalis, and then you're not able to clear the bowel very easily or the rectum very easily. Another one is if you have stress during incontinence, that can happen, but especially urgency and urge incontinence. So some clients will have a tight pelvic floor and they have stress urinary incontinence. That's when you cough or sneeze, you can't hold your urine. And that one's a real hard one to get your head around because people think, well, if I have incontinence when I cough, it must mean that I'm too lax, I don't have enough strength in my pelvic floor. But actually, you can be so tight when you cough, your pelvic floor doesn't know what to do and it doesn't know how to contract properly because it's just sort of sitting in tightness, okay? But even more common if someone says, oh, I actually have urge incontinence and lots of urgency. So urge incontinence is where you feel such a strong urge or feeling to void the bladder, to go pee, that you try to get to the washroom, try to get to the bathroom, to the toilet, and you're peeing as you go there because the bladder is contracting and you're actually not able to hold the urine inside, not able to hold that bladder and have that control, and you then lose continence that way. So if you have urgency, and potentially if you have urge incontinence, that's also another one of the things I think, maybe this person actually is a tight profile. If you have things such as tailbone pain, really common. People will fall down and hurt their bottoms and hurt the tailbone and sacral area. Oftentimes the muscles can contract and try to protect that area, or as you may know, that when we have pain, sometimes we'll get muscle tightness or muscle guarding. That creates more pain, more muscle tension, and then we get into this loop cycle. So if you've had a big wallop and fall down on your tailbone and the tailbone is sore for a while, that also may affect the tone, the tightness of that pelvic floor, especially in the back half. And then another one that you may experience is that you have sacral pain. Now, this one's a bit of a tricky one because it can be lots and lots of different things. But again, if you're looking at the whole picture and you have all these symptoms or all these signs, then it may be that you are towards the tight pelvic floor. And then of course, low back pain, but another common one is lower belly pain. So pain that sits right on the top of the pubic bone or that goes down into the groin area. Those clients, sometimes when I go in and check their pelvic floor, I go internally and I'm having a feel, I can feel a whole bunch of trigger points of muscle knots on right above, like right into their pelvic floor by the pubic bone. That's what I'm trying to say. So it kind of goes into the ledge of the bone, and I can feel a bunch of trigger points in there, and they will feel the referral pattern go just above the pubic bone and into the groin. Sits bones. If your sits bones, every time you sit down, you have pain in your sits bone. Again, if you have a bunch of those other ones, that can be a sign of pelvic floor tone too. But to recap, the most common ones are pain with intercourse, where it feels like things are, it takes a while for you to stretch out around the penis, or like I said, around a dilator, or if you feel the pain deep inside. So that's number one. Number two is if you have constipation. So people with, say, irritable bowel syndrome, if they go constipated and then a loose and then constipated, sometimes they will, but well, 50% of them actually will often have a tight pelvic floor in some areas. And if you have urgency and urge incontinence, if you've had a fall and really landed heavily onto your tailbone. So what do? Well, it'd be great if you had access to a pelvic floor therapist. You can go see them. Just ensure that you get a pelvic floor exam, right? So sometimes you'll go to a therapist and they just sort of check your posture and say, oh, your hips are a little bit out. No. You need to go. Hopefully you find someone that you can trust. And they have to check. They have to go into the vagina, sometimes even into the anus to check the tailbone area. And you have to find someone that you feel comfortable with to do that, because it can be uncomfortable, right? Because it's tight and it has a whole bunch of muscle knots, and it can be a sore area to work on. So you have to go in and you have to check the pelvic floor muscle, and then you have to go and start doing some releases into that pelvic floor. And then I've also done some other videos on other strategies, such as the use of pelvic wands or the use of dilators, pelvic stretches, ball release, hip stretches. So you can try some of those too. And the breathing techniques, also super important. But it's not just breathing. I'll have clients that come to me and they'll say, I went to someone, they taught me how to do yoga breathing with my belly to relax my pelvic floor. And that's great, because that absolutely is one aspect of it. But we also have to address this pelvic floor. I mean, our pelvic floors as women, they go through a lot, right? They have children and they have tears, and then we have surgeries and all these things. And I think they need to be addressed, and we need to look at them and check them and treat ourselves properly to ensure that we don't have problems with urgency, pain with intercourse, constipation, all the things that can be relieved by proper pelvic floor therapy. So I hope that helps you trying to figure out whether you have maybe a tight pelvic floor and what exercises you can do, and go do those exercises if need be. And if you do have an opportunity to, like I said, find a pelvic floor therapist, then do go see one. They can be really helpful. All right, take care.